all. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So, Luffy is safe, everybody is safe. We have with us Paul Bork. He is an MBA, he's a lawyer, he's a BS engineering, chemical engineering, and he is a Six Sigma black belt as well. He has been presenting to all the cool beans here weekly stats for various countries, and you can actually ask for a very country to be added to the stacks. So, with this introduction, over to Paul. Paul, welcome and thank you very much for the data.
You're quite welcome. Very, very glad to pull this together. So let me get started here. No, I've got to come over here. There we go. Okay, so first country that we were asked about was North Korea. And for North Korea, there's no data reported. I did find an article, it's right here, and it is a politically focused article, and it is dated, so it's early on in it, but it said that North Korea's handling of the pandemic is the third worst in the world. Now, whether it's third or whatever, they're saying that they're certainly below average on it. The smuggling has been shut down. There's a lot of smuggling going on from North Korea into China, and China is shutting down a lot of it because of the COVID coming in from North Korea and also some of other countries, and also because they want more control over the local area. They're actually building a wall to defend their southern border. So, and I won't say anything else about that. And international assistance was refused, and existing help was kicked out. Their industries were shut down for the to stop the sharing among the population. They've had several natural disasters that have occurred on top of it. And we do also know that North Korea has exclaimed that they have no COVID inside their country. And it may be that they have no measured COVID because they're not doing any testing. So that's what I know about North Korea.
Thank you very much for doing it. I didn't think that you will pull this together, but hey, thank you.
You're welcome. It took a little searching to find it, but yeah. We asked about Western Australia. Well, here's Western Australia. And as we can see, it's beginning. And if this is like every other place, we should have a very high peak. The last day, new cases were down at 0. This is probably just a reporting because of a Sunday, but it looks like Western Australia is beginning their Omicron adventure. We were asked about British Columbia, Canada, and they seem to have a peak, and they're kind of leveling off. They're not continuing to come down. And this is very reminiscent of what we saw in the UK when their peak came down. It came down about halfway, and then there was this kind of leveling off. And it's been suggested that was because the schools came back. I don't know if Canada has a similar event going on. I know there's a lot of trucks in Ottawa, but I don't know that this is what's causing that.
I think that there is a concept of endemicity or being endemic as well, that now it is percolating in the society. It's not just totally burnt out. So it is just now going to stay. My question to you, does these peak look similar in almost, to me, it looked like 2.5 months peaks everywhere. Am
Yes.
I correct in that observation?
They look almost the same. Later on, we'll have a bunch of countries together and we can look at that. But yes, I think it does look fairly close. We were next asked about Peru to do a deep dive because they had such a low death rate. Well, here's the total deaths per million, and I guess I was having trouble seeing the low death rate in Peru. And here's the United States, Belgium, Italy, Russia, Germany, Israel, India, and Japan for the reported death rates.
That's a very high death rate. It's deaths per million.
Yeah, the U.S. supposedly has a very high death rate for rich industrialized countries, and theirs is more than twice as high as the U.S. I just can't imagine, with all the suffering and deaths that we've had, to have 2 people for every 1 that we've had. You know, the terrible suffering going on in Peru.
I
I
understand.
mean, ours
So
is
sorry for that. And
2,600 and theirs is 6,200. So,
almost three times. Almost three times. Wow. So thank you very much for pulling that together, because I was under the impression that they're really doing something better and we should learn from them. It looks like they
I
are
don't think we want to
really
learn
helping.
from that.
Yeah.
Maybe
No.
maybe try not to do it. I don't know
Yeah.
if that's due to I mean, people are going to look at stuff. Is it due to altitude and lower pressure, but the people are acclimated to it? I just have no idea what's going on.
Got
But you
it.
can see that, look at the rate of the curves here coming up. They're
Mm,
very, very steep and very long.
mm.
And here we've added some more countries to it. And look, for example, here's Gibraltar, almost straight up. And we'll see later what that means in terms of the incident rate for it. But I added some other countries. Greece is having a number of issues right now, and this is their total. And we have Israel going along as well. Here is the daily incident rate, and this is Gibraltar. The highest of anybody else was 30 per million deaths per day, and they went over 140.
How? I'm sure that your answer is going to be, I don't know, but meaning it just, that is my reaction, emotional reaction to say, wow, that's a very
Right.
high
It'd be
number.
good to go look and see, did they have a hospital shut down? Did they lose an oxygen plant? You know, what happened to cause it? But it's got to be something. I mean, and the peak went
Yeah.
up so fast and came down
Yeah.
so fast. And these others are very broad. And so again, it would seem that hopefully this is due to some sort of event occurring and not just the disease itself. And
Mm.
it also would tend to me to underline the concern that people had of what happens if healthcare is overwhelmed. And whether this was overwhelmed because, again, an oxygen plant went out or who knows what, it to me illustrates perhaps not very precisely, but it illustrates what the concern is if hospitals are overwhelmed, what could happen.
Got it. Colombian coffee bean says small population, so maybe that.
We have some other countries that have small populations, and we don't see the same thing.
Dan Robinson says could be a data dump for those days, maybe.
No, wait, yeah, excuse me, this is Gibraltar. I'm sorry, this is Gibraltar, not Peru. This is Gibraltar going up, and it is a very small population. And they had one issue here. So that is a good point.
Mm.
And if we
So
remove Gibraltar and I put the rates for each of these peaks, you can see Peru is at the top in this peak. Bulgaria is the top in this area. Peru, again, is the green and the peak here, sort of dominating everyone for a long, long time, the highest. And then we have Bulgaria, again, the highest. So Bulgaria and Peru both have 2 times out of this group where they're the highest in the group. And
so
again, we've
who
got
has been the best in the group? Is
Israel.
that Brazil or
No,
Russia or
well, I mean, you can look and see. I mean, on each of the numbers here, Israel is the lowest in 3. Peru is the lowest or second lowest. United States, Poland, Greece, and Brazil for 1.
Got it. So this is again the same number. This is confirmed cases per million.
Right.
Got it.
And here are total cases. Maybe I think someone might say, oh, maybe Peru just had more people get sick. Well, no, they didn't. I mean, they've had, 2.5, 3 times as many as India and Japan are reporting, but Germany has more. The United States has over twice as many cases and a much lower number of deaths per million.
I still wonder, and I have really not tried to touch US stats, because anytime I talk about it, it becomes a, politics as well. But I am still kind of surprised at how did we end up in this state while there are countries that are even more populous than us. anyways, this is not to instigate any negativity, but just it's an interesting thing to observe. We have a lot of resources. Um, we are resourceful, plus we have great facilities, but here we are. Sorry, back to you, Paul.
Yeah, and again, I don't know, but it may be that we have some very great facilities, and we may have a number of hospitals that are just sort of following the protocol that's given to them, and we may have fewer people that are doing medicine and more waiting for the advice. We might have a different reporting scheme. We might have exactly the same sort of disease. I mean, it's hard to guess and see what's going on. I do remember I
But
was
at the same time,
I was looking at Texas, and they were talking to the guy that was running the health reporting for Texas, and one of the reporters say, "Why don't you do this?" He says, "Well, you don't understand." He says, "These are elected county officials. I'm hoping they call in at the end of the week to tell me. You know, they don't report to me. They're elected. They respond to the voters of the county. I'm trying to coordinate by asking. This is not a command situation." So how are the cases reported in Texas? Well, the guy running the program for Texas can't force the county medical examiners to change how they report cases. And I'll guarantee you the guy running Texas isn't going to respond to what the US government asks, whether it's, whatever political party. No, we've got this individualism and this county-driven system. Right or wrong, Great Britain, Hong Kong, China have a government centralized control. So they have much better consistency in how they report. We can argue whether it's better or worse system, but again, the differences may be something like that. I don't know. I mean, just looking at the data. But again, I think
sorry, please complete your thought.
I was just going to say, I think there's going to be a PhD thesis or a master's thesis given out later on in 4 years, 3 years, 2 years that will explain what these differences are. But right now, there's no good way that I know to find out.
Got it. And Denise said it's got to be their genetics and lifestyle and diet. That may also be a possibility. We do have the obesity ratio more than other countries. We do have a lots of comorbidities as well. So yes, that may be. Now, an interesting thing in this context, over this weekend, I was speaking with a journalist friend. She's writing an article, and for that she's preparing some data. As part of that data, I was discussing California study, and there was some part of data in there that was interesting. So while that discussion was going on, I called a doctor friend in New York, and here is what he said. He said, so the question was vaccination, not vaccination, what are you seeing in the ICUs and so on. So one, he said that I am seeing that vaccinated are a little more protected. So good, fine, understood. But he said many times nowadays for cases, he said these are incidental findings for us. People come in for something and you test them as a routine test for COVID as well, and they turn out to be positive. So he said they're not coming in because COVID has made them sick and they're seeking help. They're coming in for other things. And that has also kind of changed the case rate. And he said, how many are the ones who have COVID, just like these patients who came in, and because they have nothing else happening, they're not coming in and they're just becoming sick and becoming okay. So there is I think case counts are not really very reliable anymore.
I think they are getting less, and I will talk about that again a little bit later. But also, we heard the same thing from Israel, and we heard the same thing from the UK, that half of their Omicron cases were incidental and not people coming in. And so one of the questions is, are the Omicron cases artificially high, that they're testing better, and if people, maybe more people are coming in because the hospitals are less full for other things, and with Delta, the people weren't coming in, weren't tested, and so we don't really know that. If we look at
one more comment from John Snyder as well. My apologies, I am interrupting you.
That's quite all right.
So John says US has a lot of genetic propensity towards genetic diabetes, even if they excuse me, they don't claim tribal status. A lot of people with Native American heritage with 50% chance of diabetes in the Midwest. So that comorbidities are also a factor.
And it does really make a difference. If we remember the Johnson & Johnson vaccine showed phenomenally lower or differential efficacy with different racial groups.
Robin, thank you so much. You're doing a great job for Paul Bork. So, Paul, you used to do the statistics for the likes. Today, Robin is doing it. Robin,
thank you, Robin. Appreciate your filling in. And so here we have the current cases for some of the European countries. We've got Russia coming up. We've got Peru here. Japan, the US, and the UK are sort of the benchmarks that we've been using before. We've got the Canada, India, and so this is just to show relatively where they are. And you can see France came up higher than Belgium, not as high as Israel, but certainly higher than the UK, and certainly higher than the United States. And this has been, the time has been pulled out, and so we have a much shorter time. So if you remember looking at the overall pandemic time, the UK was a very sharp peak, and here it's much more spread out. And so that means Israel, France, and Belgium are very, very sharp peaks as well. And we've got Germany still coming up, got the UK coming down, the US coming down, and this just shows where some of the countries are.
Interesting.
And here the same graph with the highest countries dropped out, so we can see what's really going on at the lowest end. And here I've pulled out if you hold your cursor, hover it, it'll show that, but it covers up the graph. So I pulled it out and put it as a separate thing. We've got Germany coming way up. This is the UK's peak. This is the United States peak, lower, and Germany looks like it may be starting to turn over a little bit. We've got an inflection point where the rate of increase seems to be going down for them. Russia's still coming up. We've got Peru seems to be coming down. It's this one, the jagged up and down. I don't know why Peru is so jagged and other countries are smooth. It may be the reporting mechanism is collecting cases and grouping them together in Peru. And also Canada, you can see, is more grouped together. And we have, Luffy isn't allowed out, but maybe Luffy was over in Canada.
This is why he is grounded now. And a quick note here, Janet said, I don't think the comments here persist once it is posted. No, so they do persist. What happens is, after a live talk, YouTube system takes a little few minutes, depending upon the length of the talk, to kind of absorb it and then process it and then get ready to show it. During that time, they remove the comments, or they disable them. Once they have processed it and made it available again, it is available, but they're doing something. I cannot make changes to it either. Then about an hour or so later, the comments, the live talk becomes available as well. Sorry.
And you can see India up and down. We can argue whether it's over-reported or under-reported, but if it is consistently reported, the shape of the curve should be related to the overall cases. And you can see Canada came down and had this little leg that came off, just like the UK did and came down. The United States came down flat and hasn't had that, even though it's gone past where the UK and Canada would be in their curve. So it appears, I thought it was just a UK specific thing, but it appears something else is going on. And I don't know what is consistent between Canada and the UK that would cause those to occur. And if you notice, they're occurring at about the same date. So again, could it be students coming back or not? I don't know.
Got it. Got it. There's a fun discussion going on the side. That's about the Luffy and his supplier. So yeah, something was happening, and Barbara believes he should be permanently and completely grounded. If Luffy could speak, I would give him this comment to then comment about it. And remember Raj? So Carol, Raj's mom, Raj goes out at night as well. But what Luffy pulled was not the best thing for him. So he's grounded for at least for the nighttime. Sorry, Paul. Back to you.
Well, if you did ground him for a long, long time, you might get better sleep, right?
No, so he's such a thing. He woke up today at 2:30. Then he first goes down to the main door and he stands there and meows. If you don't come in at his service and open it, then he would come in your room and meow. Then he goes to everybody's room and stands outside and meows till someone wakes up and gets him out. So today we all woke up, but nobody let him out, to his disappointment.
Well, if you have to make sure everyone's on board for the grounding and nobody breaks ranks.
So
Here,
that plan was done already. So once we found him and brought him back, then there was a team meeting, and we, the servants of Luffy, decided that Luffy cannot go out at night.
okay, very good. Here's the Omicron rate among those countries, and you can see that it is pretty much the same. We've got Russia coming down. If you remember, the last time I talked, we had Germany that was coming down, but then it popped back up. And I suspect that this Russia thing will end up being come back up higher, and that this is not a real decrease that's going on with the Omicron. But we're seeing everyone getting essentially the same curve. Some are a little later, like this is the Germany curve, and we have Belgium and we have Israel and the UK and the US, and it's all really the same curve. And we have essentially 100% Omicron. And nobody is reporting the BA1 and the BA2 with Omicron. They're just reporting Omicron together. And here's the current day showing, Peru up and coming down, with Japan and India and the US as reference points. And Japan just continues to go up. And you can see the Japanese increase is at a much flatter rate than the US or Peru. And so they're doing something that is slowing the rate of the Omicron cases coming in. India is pretty much the same slope as Japan, maybe even a little flatter, a little more effective resistance. And here's the requested countries that we had put together, and a couple of references. We have the Denmark, we have Israel, Iceland, Sweden, and a number of them going down, Mongolia, India, and I think I have, oh, okay. And so we can see where that is. Just a second. I think I can do this. Yep. So here we have them expanded a bit. Israel up and down. Denmark not as high, but coming down. Iceland, Sweden a little lower. Greenland much higher and coming down. And so Greenland and Iceland together. And then we have Finland, the US, Peru, Japan, Mongolia, sort of similar thing, up and down as sort of Peru. And India, again, is flatter here because of the height of some of the other. And then we wanted
So
a
can I
US.
ask you an overarching question, which may be loaded question, and you can totally say, don't know. Are we at the end of the pandemic?
Well, the data would say, why are the cases coming down? Why did Omicron go up so fast and come down without everybody getting it? Is there some underlying resistance? All these countries are pretty much the same, pretty much in terms of the duration. Is there some underlying resistance to this Omicron, and if so, and if that continues to be effective, then we very well may be at the end of it. But if it is something that a new variant comes out that is different, like Omicron not seeming to respond to Delta's immunity, we could go further. But I'm hoping that we're over, getting close to the end. And as you know, my EndBeen name, that's what I'm always looking for.
So I was reading a study from Los Angeles over this weekend where they had done a survey of the sero prevalence or seropositivity in all population, vaccinated, unvaccinated, infected, uninfected. And they found out that folks who were unvaccinated and were not previously exposed, or at least they didn't know that they were exposed, 28% were seropositive.
Okay.
So so imagine if in some society we have anywhere from 50 to 70, 75% vaccinated people. Then we must have a 10, 20% recognized people who were infected and recovered. Then in the remaining part, there are about 30% that are seropositive anyways. So I think it is possible. And after this talk, I would share some of these studies with the Cool Beans as well, if they would like to hang out a little more.
Sure.
It seems like COVID is actually, Omicron is actually going to people. Some of them don't even know it. And then it is giving them the immunity, or at least making them familiar of the SARS-CoV-2 and then getting out. I mean, think about my case. I
And
would have never known it was SARS-CoV-2 till Rima said, why don't you do a test?
And I remember hearing a Ugandan doctor say that Omicron was a vaccine we should have made.
Yeah. Yes.
Yep. That's what he said. Okay.
Yes.
And I was asked to focus on the US to take a look at that. And here's the overall US rate. It's coming down. We're not getting the flattening out here, the peak. And again, remember the width of this just is a function of how long the timeline is here. And so since we're focusing on the current, I just cut it off. And if I had shortened it, we would have a lot more vertical and more spiky. But here you can see that this seems to be trending down fairly consistently. And if you look at like the slope, connect the first and the last dot, it's fairly consistent with the rest. There's a little bouncing up and down, but it's not like the curve is migrating farther away or coming in. The last 2 points are a little further, but we're not getting the flattening off that we saw in the other countries, that we saw in the UK and Canada. Now, people say, why is the US?
I have a suspicion that US is reaching this seroprevalence levels, higher levels, even when people are not even aware of it.
And we have kids returning to schools and all that, and we're not seeing that, we're not seeing an uptake. So there's something that's providing protection, and it certainly seems what you've suggested makes an awful lot of sense to me. And the reason that the US is coming down, I hope you all appreciate this. This slide took a lot of work. And so if we take a look at the first 12, if we look at the 12 largest states in the United States, every state with population over 8 million. The 11 highest cases, and Virginia is a little lower, and so it's 16th. And they have a case rate between 200 and 270 per 100,000. Virginia's 183. Again, with the different reporting, I'm not sure there really is an effective difference between the various states. But you can see I've got the 4 highest states here. They're all up and down, up and down, up and down, up and down. And you can say, well, here we've got, this one is
New York.
This is New York, and it's further down. It started a little sooner. California started early, but isn't quite as far down. Florida is down a little further, and Texas is coming down, but not as far down. And
so can I say that this, number one, thank you very much for pulling this data together. Number two, can I say that regardless of their implementation of various things, for example, Florida is definitely different from the rest, the curves look the same.
Right. And so that goes back to a paper from Johns Hopkins that gets a lot of attention that says the shutdown and all of the governmental attempts to restrict the cases didn't really make a difference in the death rate. We're seeing essentially the same thing here. If you look at California versus California, New York versus Florida and Texas, if it really costs a lot more to do a program in one or two of those states, it's hard to see that there's a real benefit from it.
Got
And
it.
so these are the 12 largest states, or the 4 largest, and here are the
And Paul, a quick comment. I thought that the lockdown study was from folks who worked in Stanford, right? But Stanford had said that we have not endorsed it. This is just people who work here who did this. Am I correct in that one? Is that the one or
well, I'm thinking the one that came out of Johns Hopkins, but I believe
John
it's the same
Hopkins?
kind
Yes,
of thing. I think you'll find a lot of the leadership of the universities don't want to get into the political fight, right wing or left wing. They don't want the fight. If someone is
Hmm,
publishing under, as part of their organization, they'll say, go talk to whoever published it. Don't, this isn't the university position.
got it. There is a request from Self Selfla that can you zoom in? Is it possible to zoom in on
Oh yes,
this?
just a second. Come on. Nope. I clicked on the wrong thing. That was my mistake. So what do you want to zoom in on?
Maybe these charts.
There's the California chart. There's the Florida chart. There's the Texas chart. And there is the New York chart.
Thank you very much.
You're welcome. And then here are the 5 through 12. I didn't put the names up, but you can see the same sort of thing. There's a little difference in the shape of the curve and a lot of more difference in what happened with the Delta wave before it. But for the Omicron, it looks like it is making no difference.
That's very interesting, actually. Omicron has a similar behavior at the state level, I'm sure at the city levels, and at the country levels too. Going up, going down, done. We should
And
actually look at South Africa to say they went up and down. What are they doing now? So why don't you do this? And I'm gonna go to our world in data and just quick peek on South Africa.
right, and taking a look at the overall case rates, there were 7 states higher than those 12 and 8 states in DC that were lower. So here just are the numbers for that. So those really do represent the United States. And now going to the Nordic countries. We had asked for that. Here's Denmark, Sweden, and Finland. People are interested in Sweden because of their differential approach, and Denmark because they declared they're done with it. They're no longer restricting anything, and their cases have gone up dramatically higher.
Very interesting. So Denmark is actually high, Sweden is going downwards, Finland is kind of percolating on that state.
Right. And so Finland may be spreading the curve, having cases for a longer period of time, but less high in Denmark. And here I've added the United States and Japan for reference. And you can see Sweden and Denmark are much higher than the US has ever been. And Japan just keeps ramping up and up and up. And here's the percent of Omicron. And again, we got the same curve for everybody, just a slight difference. And the difference that we're seeing here between the United States, Israel, Japan, and Sweden that's reported, it may be measuring versus the Omicron actually being different inside the state, because they may be reporting their measurements at different times. Because if you look at the dots that are here, if we blow this one up, you can see that the dots are not all at the, they're fairly close here. They're being reported by per week, but every 2 weeks. But it's reported at this time, but was the measurement actually taken here or there. I mean, they're reporting every 2 weeks, so these will always be lined up, but the actual data that they're reporting may be 3 days old, it may be 7 days old, or 12 days old. And then talking about what's going on in the UK. The Zoe app has talked about this. The Zoe app, the top number is reporting everybody, and the bottom number is reporting people who have said that they are vaccinated. And this is people reporting their symptoms on their phone app. And so these are just systematic cases. And you can see that there's a definite upturn that's going on in the UK.
That's so. I will contrast this with South Africa. I don't see another peak in South Africa. They went up and down, and that's it. They are now just at that down level. If you don't mind, I can quickly show South Africa. I'm going to share my screen.
Sure.
So this is South Africa's graph. For me, the curiosity is that what's going on after the peak is done, and South Africa is one of the first countries. So if you see here, this is their peak. They went up, they started going up on November 24, 25, 6. Then they peaked at December 18. Now they are down. If I zoom in here, they came down, they became a little less vertical by January. And then during the month of January, they kind of kept coming down. And now since January 24, they have become more of a horizontal. To me, this seems like an endemic state now, where it's just percolating, going from one person to the next, and then that's about it. Not
right. And they had
peaks.
two breaks going up the curve. They had one right there, and they had another one coming down that was just a little not as significant, but they had two breaks of their downward trend.
Yeah, they had it one here, another over here. Then they kind of became.
And now they're really just flat and much higher than they were before Omicron started.
Yes, so you're correct. So before that, they were here, 266-ish per day. And now they are at 3,202 per day type number. And they're just on that. To me, that seems like a R naught of 1 and an endemic state. If I go to their death rate, or these are confirmed deaths, not death rate. If you see them, so this is July. Let's go to January. So January, so here, this is really, let's say December was the month in which they had the cases, highest cases, and then January is the fallout. So as you can see, January actually increased at 1.167 per day. I think that's data reporting thing. And then at 1.66. But if I have a running average, I don't. But they are between 100 to 100.
There may be one
about 100
above to pick that. Whether you're reporting 7 day or
sorry.
There may be look a little higher on the graph, higher up. Is there? It says confirm. No, this is the country itself. So no, you won't have it. Okay.
Yeah, but interesting. So if I just look at the numbers here, 100 to 150, they are now between these two. So I'm thinking the average is going to be 120 per day. They are on that average now, kind of percolating there. So it seems to be their endemic state. That about
well, I would think perhaps a little different because we didn't see a peak for the Omicron peak. So we may have a bunch of people that have gone in the hospital and they're just weaning, they're just having them die off. You have a whole bunch of, not a whole bunch for the whole country, but you have a number of people that came in with the Omicron peak and they're trying to be treated, and some of them are just dying as we go along. And that may be that the Omicron peak leveled off as the amount of care can be very high for the country because they're not overwhelmed.
That's true. So it is actually possible that as more weeks come in, we'll see in the endemic state what is their death rate sustained To me, that is how it looks like it's going to just stay within this society till everybody gets it once and then move on.
Yeah, so hopefully that will come down, and that will be the reflection of the peak. It may be spread out because the doctors are not keeping everyone, that people are not dying at the same amount of time after they came into the hospital. And so if they're spread out, then we may see that come down gradually come down, or come down fairly quickly, whatever.
Yeah.
Depending on the treatment.
Very interesting.
So here we have the Zoe app that shows if going back is okay. Yeah, so if we have the Zoe app showing it comes up, here is the case rate that's reported by the UK government with the black dotted line, their 7-day average, the yellow line being their individual reports. And you can see the reporting scheme, and you can see it tracks fairly well with the Zoe app coming all the way back. And now the Zoe app is going up and the official numbers are going down. And so the question is, what's going on with that? And this is a collection of what the Zoe folks and Tim Spector was reporting a little while ago. And he's looking at the correlation. And again, these numbers are the correlation with the Office of National Statistics. That's showing fairly good. And here's Tim Spector, and he said that's showing that his numbers are good. Well, I'm not sure it does, because the national numbers are as well correlated with the Office of National Statistics as his are right up until this point. So I'm not sure that when he was saying that this correlation, it certainly shows that the Zoe app was as good as the national report, but it doesn't help us decide which of these two is now correct. Did I say that in a way that made sense to everybody?
It does. Thank you.
And here is the positivity in the UK at this point. And you can see the positivity rate is going up just the same way that the reported systematic cases are going up and not continuing down as the government official figures are. Then we have this is the percentage of positive lateral flow tests followed by a PCR, the percentage. They were running 60 to 70%, and then the number is coming down, and lately they're below 10% of the positive lateral flow tests that are followed by a PCR, and only the PCR confirmed cases are counted in the government's official numbers. So Mr. Spector was, or Dr. Spector was suggesting that this was probably a cause of a systematic undercounting in the UK.
Got it. And it is possible.
Yes. I mean, if the UK is thinking that this is done, why are we continuing to spend money to do all this testing when we know this is done and we're lifting the requirements? It may be perfectly the right thing to do from a government standpoint, but it messes up the numbers and it makes it difficult to see the reporting. And we may have the same thing going on in other countries as well. I know that some in the US have suggested it's very hard to get a test, certainly more so than it was a month or a couple weeks ago.
And I shared a news on Twitter that it is also possible that the tests that we have received from government, they may not work because of the cool temperature or cold temperature they've been in, either during their travel or when they reach your home. And so their whatever structure gel is there, it could be not functional correctly. So
right, and I won't say anything other than I've heard a few people complain that the tests that the U.S. Sent out to some of us were sourced from China, and they thought that was kind of interesting that we have a Wuhan virus and a Chinese test for it. Anyway, going on to Iceland and Greenland, we had asked. I'm pulling them together because they're sort of islands out by themselves, and see what their rate looks like. And I put in Israel, the United States, and Japan. Israel because the Iceland cases or the Greenland cases were so high. I would just a comparison that they're not as high as we're seeing in Israel, but certainly higher than we had in the U.S. And if you remember, the UK was lower, and we have Japan as sort of the level. And so they're just here for reference. And so we have Greenland and Iceland that have had remarkably different responses to the Omicron. And they don't have any report of what percent Omicron they have, but I think I can guess what their percentage is. I then took a look at the Indian subcontinent, just sort of going around. And I left Japan in for the reference. If you remember how low it was, now it's very, very high. And I'm grouping the countries together because maybe there's a systematic reason why the cases are the same in a geography because of temperatures or because of foods or because of reporting or whatever. But so just showing the relative rate in the among the neighbors. And we have Nepal up and down. We have India up and down. We have Bangladesh up and a little down. Sri Lanka sort of coming along. We have a sort of step function, but we had that going back. So I bet that's a reporting issue and not really a thing about how the disease is progressing. We have Bhutan that is coming up and almost as high as their prior peak. We have Afghanistan just sort of starting up. And again, I don't know what the reporting issues are or whatever, but if they're consistent, you can compare what's happening today to what happened several weeks ago or months ago. And as we saw, Tim Spector was suggesting the UK had changed their reporting, and so that couldn't be done anymore there. But I have no reason to believe that's happening in any of these countries.
Interesting that Pakistan has a lower peak, but kind of wider.
Yes.
That seems like the data reporting thing.
Well, actually, is it really wider? If you look at Nepal, when Nepal comes down, the distance between the up and down for Pakistan and Nepal will be about the same. It's just Nepal's cases are much higher. In India, the same kind of thing. When India comes down, the duration doesn't look to be much different. It's just the height of the peak.
Yeah, you're correct. You're correct.
So again, is that percentage reporting? Is that effectiveness of the whatever? I have no way of knowing what it is, but it does look like the reporting is being consistent for the various governments. We're not seeing something that looks like they got halfway through and the government shut down reporting or suddenly increased it or something.
I was speaking with a medical student in Pakistan this morning, and she was saying that everybody has cough and everybody has nasal congestion nowadays. So over there, I think they're not even considering it anymore, the SARS-CoV-2. It says people have cough and nasal congestion, and it is cold season, winter, so that's it.
Right, and so this would make perfect sense with it. We have Pakistan up and down, and maybe these are just the hospitalized cases, a certain percentage. Nepal maybe are reporting more cases for some reason. Maybe they're having 5%, 10%, the politically important, whoever, getting tested. And so they have, the same kind of curve, but just more people in. And maybe Japan is doing something else. Although if the duration is the same, Japan should be coming down, and they aren't. But if you look at the slope of Bhutan and Japan, the slope up almost the same. And India, very consistent with the slope up. But Japan just keeps going and going and going. So I think there's something different going on there. It's not just a reporting issue.
Looking at South Africa, if I look at their going up and down and then the flat trend, to me, it looks like in a couple of weeks or a month, we'll all be in that flat, lower level percolation, which we would then call endemic, and we'll say we're done.
Right, and it looks like
so there's not a statistical.
But just looking at the curves, Nepal is almost at the point where South Africa flattened out, given where their peak is. India isn't there, Bangladesh isn't, none of the other countries here are. And so again, is that really going to happen? And we go back up here. Israel isn't that far down, but Greenland is that far down. If it was going to level off the same way, it would have leveled off right here. And the United States, maybe, but and Israel hasn't come down enough to do the leveling off. So it'd be very interesting to see if they follow the same general curve. And Greenland and Iceland didn't report Omicron. Here's the Indian subcontinent. And Bangladesh only reported cases up to this point. But again, we've got Japan in here, but India and Sri Lanka, and there's no reason to believe that all the other countries aren't following along pretty close. Decided to take on the Middle East. And so
Let's do it.
Here we've got Luffy looking this way, I think. From the back.
This is the bent out of shape Luffy because of the curfew that has been imposed.
It just twisted Luffy all the way up. And you look, we have Israel, and then we have these other countries, and these curves seem to be longer, significantly longer than what we were seeing before in the other ones. And we've got the list of the various countries, and I'll give people a minute if they want to go look at their favorite country. And we've got Japan, the United States, and Israel again. Israel is in the Middle East, but those are the reference countries.
Interesting that they have a wider, either that is a reporting thing or that is a local whatever.
Well, let's look. I mean, here's the U.S. period, and so again, it may just be I've expanded the graph differently. But here we've taken Israel off so we can see the shape of the curves of the other countries. And look, we have Kuwait coming up, and then a double bump. I mean, was this a Delta cases, and then Omicron came in? Qatar, just the one peak, sort of like the U.S. Jordan is still going up. You look at Palestine, still going up. You get a little stickiness or whatever, which is probably just reporting issues. We've got Iran coming up and flattening off. Iraq looks very, very broad, about as broad as the U.S., right? Egypt, about the same, not as high. And Yemen is reporting almost nothing, so you can't really see that. But United Arab Emirates, up and down, it looks again like the durations are about the same. It's the peaks that are different. And again, that would seem to be perhaps a reporting type of issue, that they're not collecting the same cases. And here we don't have any real reports on, we have Qatar and Egypt. Egypt saying that they started at about 27% and now they're down to about 5% Omicron. And that doesn't seem quite right to me. Then I went to Southeast Asia. We're getting very close to the end of what I had collected. And we have, again, Japan as the reference. I've taken the other higher countries out. And you can see Indonesia up and down. And that's probably a reporting issue, but a nice smooth curve. And again, if we're going to have a flattening off, Indonesia is either overdue or about ready to flatten off if that's going to happen like the other countries.
The Omicron seems like this big broom that went everywhere and just did the same one spike and done.
Right. We've got Indonesia with islands, so many islands. Their peak may be more spread out for the disease. It may be more difficult to go from island to island than it was to go from state to state in the U.S. We have Vietnam, and we have the double cat ears right here too. Anyway, and Laos seems just to have been percolating along and coming down. So I don't know if they have Omicron in there yet or not. And Cambodia is not reporting. And Malaysia, flowing, and maybe it's starting up, but it's roughly about where it had been going up and down before. And here's the very similar curve that we're seeing everywhere in terms of the Omicron percentage. We have Cambodia reporting not much, but their number of cases is down. I expect this number to jump up in a later report to be corrected. I expect Malaysia to jump higher as well. We have the Philippines that just have these two reports, but very, very high rate that they've reported.
Got it.
And that's the end of what I have.
Thank you so much. Fascinating. It almost looked like we visited the globe with you.
Well, we've included a number of places. So if there's someplace else somebody would like me to pick up, let me know. And otherwise, we'll go and try to find something else that's interesting for next week.
Thank you very much. Thank you for pulling this data together. And Cool Beans, as usual, if you would like to support it, the minimum you can do is like this. And if you would like to support further, there are links in the description for buying me a coffee or PayPal or being a patron. So, Paul, thank you so much for pulling this data together. This was a lot of work.
You're quite welcome. Glad to do it.
And Cool Beans, I would come back. I have a few things to share, the studies. There is an Alberta data study that I wanted to share. There is a California study data that I think is interesting to look at as well. Plus, there are some questions I had asked today on Twitter if there are questions about Novavax, and there are some questions. So I'm going to try to do multiple talks and see how long can I stay up and do them and how long you can be here. But I'm going to come back and do some of those talks as well. So thank you very much. Thank you, Paul, for being here. And I'll see everyone in a few minutes.